Namaskar, I am Dr. Rohit Swami, medical oncologist, cancer specialist, Narayana Hospital, Jaipur. So, this World Cancer Awareness Day reminds us to spread awareness throughout the world about various different kind of cancers. And today we will be discussing about lung cancer, how to know about the risk factors of lung cancer, how to avoid having lung cancers to our near and dear, as well as what can be the treatment options of lung cancer. So, lung cancer is the most common cancer throughout the world. Every year, this cancer claims around 5 lakh lives throughout the world, and this cancer is the most common cause of cancer related death throughout the world, including males and females. So, talking about risk factor of lung carcinoma, most common cause of lung carcinoma is smoking. So, tobacco smoking in form of cigarette or in form of BD, hookah, all causes lung cancer. Even we can say that one smoke of this one cigarette can lead to 60 different kind of carcinomas or cancers throughout the body. So, generally, when we have one this puff of cigarette, it can lead to 60 mutations in which each and every mutation can cause lung cancer. But our body immunity clears all of these mutations and we remain healthy. But as soon as the exposure to cigarette smoking or tobacco smoking increases by around more than 5 years, these mutations keep on piling up in our body and are not cleared by immune system effectively, and this lead to lung cancer. Similarly, other risk factors of having lung cancer is environmental pollution like air pollution. Others are like our occupational exposure, like exposure to certain chemicals like asbestos, or exposure to fine cotton pieces, which often happens in textile industry, that can also cause lung cancer. So, if we can avoid this harmful habit of having smoking in any kind, whether BD, cigarette, or hookah, we can avoid our most common risk factor of having lung cancer. To avoid other risk factors, we have to keep our healthy lifestyle. We should have exercise for at least 45 minutes per day, have a healthy. So, if we think that lung cancer occurs only in the smokers, then we are absolutely wrong. Lung cancer definitely occurs more frequently in smokers as well as occupational hazards receiving patients like exposure to asbestos or other chemicals. So, lung cancer can also occur in those patients who were never a smoker, or the patients there are familial cases of cancer. So, these are certain genetic factors as well as mutation in those patients also. Lung cancer can occur where there is no history of cancer in their family. So, all of us are at the risk of getting lung cancer, and generally, this risk of getting any kind of cancer or lung cancer increases with the increasing age. So, what are the symptoms which we should be cautious about to diagnose this disease early in stages, stage 1 or stage 2? So, various symptoms which should be alarming in our day to day life are like persistent cough which is not going even after 2 or 3 weeks of treatment, chest pain, if there is any blood staining in the sputum. So, coughing blood or red colored sputum. Similarly, chest pain. If there is chest pain, whether left or right, or if there is back pain, then we should think about it. Shortness of breath and very sharp pain on deep inhalation, wheezing. If there are repeated lung infection or there is sudden weight loss or decreased appetite, then we should cautious to meet our oncologist and we shouldn't take these symptoms lightly. Coming to diagnosis of this cancer, so diagnosis can be done by the simple chest x-ray also. Your oncologist may require chest x-ray, CT scan, bronchoscopy, whole body PET scan, and CT guided biopsy or endoscopy guided biopsy to diagnose this disease as well as staging this disease. And treatment definitely depend on the stage of the disease. If we diagnose this disease very early, then we can be cured, and percentage or chances of getting cured increases as soon as we diagnose this disease. Coming to the treatment aspect of lung cancer, so 1 to stage 3 lung cancers are curable. So saying curable doesn't mean that 100% of these patients will be cured. The percentage of getting cured depends on which stage we are diagnosed lung cancer. Like in stage 1 lung cancer, we will say that around 80% of patients get cured. Similarly, in stage 3 lung cancer, this percentage fall up to 25 to 30%. So even if patient is diagnosed in stage 4 of lung cancer, then still it is not life sentence to the patient. With the modern advancement in the treatment of lung cancer, now at present we have targeted therapy, immunotherapy, chemotherapy was already there with us. So with these kind of treatments, we can increase longevity of the patient as well as we can also increase good quality of life. For example, if I say that a patient who is diagnosed with the stage 4 lung cancer around 5 to 7 year back, longevity was around 1 year or 1.5 year. But with the immunotherapy, targeted therapy and chemotherapy, we can increase the life of patient even up to 15 to 20 years with the help of immunotherapy, even in stage 4. So giving up hopes if the patient is diagnosed with stage 4 lung cancer is not necessary with the present modes of treatment. So these targeted therapy and immunotherapy works very well even in stage 4 lung cancer patients and increases their life by 10 to 15 years or more than that, depending on the response and depending upon the durability of response. So my take home message will be that you should be aware of the symptoms of lung cancer as well as you should avoid all the risk factors associated with the lung cancer. As I told already, you should avoid tobacco. Even I will say that chewing tobacco is also a bad habit. It can cause oral cancer or throat cancer. Smoking in any way, whether cigarette, bidi or hookah smoking, should be avoided. And the addiction of this tobacco is because of nicotine, which is a chemical in this tobacco, and de-addiction is now very much possible and very easily possible with the help of several medicines which are now available with the modern science. So the patient who are addicted to tobacco smoking and get rid of this habit with the help of your oncologist or psychiatrist, and the people who have been smoking since a very long period like 20 years to 30 years should have regular screening of lung cancer. For the regular screening, you have to meet your oncologist every year, get a low dose CT scan done. The CT scan of thorax is done where the lungs are seen, and if there is any single nodule in the lung, it is removed or biopsy is done so that we can diagnose as well as treat this lung cancer. And each and every person should be aware about the symptom of lung cancer, which I told already. If there is persistent cough, if there is blood in cough, if there is chest pain, if there is shortness of breath, or if there is pain in the back, or if there is weight loss or decreased appetite. So we should be aware and we should make our near and dear aware. So together, by spreading awareness and diagnosing this disease in early stage can make a difference in treatment of lung cancer. Thank you everyone. Stay healthy, live healthy.